What is prescription drug abuse and settlement? Topical specialist Dr. Manish Bansal. Prescription drug abuse is the use of a prescription drug or medication in such a way not intended by the prescribing physician. Prescription drug abuse or problematic use includes all from having a friend's prescription painkiller for your back pain to huffing or injecting ground-up pills to get high. Drug abuse may become ongoing and compulsive, despite the negative outcomes. A rapid problem, prescription drug abuse can affect all-inclusive age groups, but it's more general in young people. The prescription drugs most often abused include painkillers, opioids, sedatives, anti-anxiety medications, and stimulants. First-stage identification of prescription drug abuse and early intervention may stop the problem from turning into an addiction. Signs and symptoms: prescription drug abuse rely on the particular drug. Because of their mind-changing characteristics, the most commonly abused prescription drugs are mentioned as opioids, such as oxycodone, oxycontin, roxicodone, and those containing hydrocodone, Vicodin, Lortab, Norco, used to treat pain. Anti-anxiety medications and sedatives, such as alprazolam and diazepam, and hypnotics, such as zolpidem, used to treat anxiety and sleep disorders. In some cases they are used as hypertension controllers. Stimulants, such as methylphenidate, Ritalin, Concerta, others. Dextroamphetamine and amphetamine, Adderall XR, and dextroamphetamine, Dexedrine, used to treat attention deficit/hyperactivity disorder, ADHD, and certain sleep disorders. Summary: if you take a drug in a way that it is alternative of what has been prescribed or from what the doctor prescribed, it is called prescription drug abuse. It could be taking a medicine that was prescribed for someone else and taking a larger dose than you are supposed to. Taking the medicine in a different way than you are supposed to. This might be crushing tablets and then snorting or injecting them. Using the medicine for another purpose, such as getting high. Abusing some prescription drugs can lead to addiction. These include narcotic painkillers, sedatives, tranquilizers, and stimulants. Each medicine has some risk of side effects. Doctors take this into consideration when prescribing medicines. People who abuse these drugs may not get the risks. The medicines may not be safe for them, especially at higher doses or when taken with other drugs. Treatment and recovery from prescription drug addiction. Addiction to any drug is a disease that, like other chronic diseases, can be treated. In fact, millions of people are living in long-term recovery and many drug addiction rehab centers are treating patients just for rehab. No single type of treatment is appropriate for all individuals addicted to prescription drugs. Treatment should be taken into account the type of drug used and the needs of an individual and may need to incorporate several components, including detoxification, counseling, and, in some cases, the use of pharmacological therapies as well as mutual aid, self-help and recovery support. But yes, support is all necessary to run this cycle of recovery, as without support, no one could help to anyone when someone is addicted to drugs or prescription drug abuse.